So many of my patients focus for so long on getting to that positive pregnancy test that once they get there, they then think, now what? You may not be ready for this episode. So, this is talking about someone who is in their first trimester and learning all about what to expect and how to take care of yourself. And if you're still trying and you are not ready to listen to this, come back, save this episode, because I hope that you have your first trimester, your positive pregnancy test that leads into that first trimester. I hope that happens to you soon. But if you keep listening, we're going to review all you need to know about the first trimester. Welcome to the Baby or Bust Fertility Podcast, the podcast with interviews and in-depth discussions on all topics reproductive health, created to support anyone curious about infertility, miscarriage, and early pregnancy. I'm your host, Dr. Lora Shahine, a double board-certified OBGYN and reproductive endocrinologist and former fertility and IVF patient myself, helping build families for almost 20 years, and dedicated to supporting and educating you on your family building journey. So today we are going to, number one, review the first trimester, exactly what it is and exactly what's happening. Number two, review common symptoms. What's normal in the first trimester and what's not normal? Like, when should we worry? And number three, we're going to answer the 5 most common questions that my patients ask me all about the first trimester. Stick around to the end because I'll leave you with top tips for taking care of yourself during this really special time. We're going to go over 3 main topics. Number one, we're going to review exactly what the first trimester is, what is going on with your body, and what is going on with the developing baby. Topic number 2, we're going to go over common symptoms of first trimester of pregnancy, what's normal and when to worry. And topic number 3, we're going to go over the 5 most common questions my patients ask me about the first trimester. We're going to answer them one by one. Topic number 1, what is the first trimester and what's going on? The first trimester of pregnancy is actually from the very start of pregnancy through 13 weeks and 6 days. So basically up until about 14 weeks of pregnancy. It's about 3.5 months of pregnancy. The way it's timed is when you actually have a positive pregnancy test, you're technically about 4 weeks pregnant because we date from the first day of the last menstrual period. Now, if you've done fertility treatment, I know that can get confusing because we often will do the pregnancy test about 10 days after an embryo transfer. And you sort of say to yourself, well, the embryo's only been inside for 10 days. How can I be 4 weeks pregnant? It's a little bit arbitrary, but just basically remember when you can first have a positive pregnancy test, you're about 4 weeks pregnant. So we're talking about that moment for the next 10 weeks until you are 14 weeks pregnant. When you're 14 weeks pregnant and you're getting into the second trimester and then later on the third trimester, we're talking about this first 14 weeks, which is really only, again, about 10 weeks of knowing that you're pregnant. I know that's confusing, but you got to understand what we're talking about. During this time, it is absolutely amazing. The embryo is going from a ball of cells that's called a blastocyst. It's about 100 cells and it's implanted into the uterus and turning into a full-fledged fetus with a heartbeat, little brain, spinal cord, gut is starting. It is absolutely amazing how much happens in this really precious time. All the organs are forming. Your body is changing tremendously. Your cardiac output is increased. You are feeling things are changing. And this little tiny ball of cells that you can't even see without a microscope is turning into a full-blown fetus that is about the size of a kiwi. It's about 8.5 centimeters in size, or about 3.5 inches. It is absolutely amazing. And your body is changing so much during this time, just like that baby growing. It is just incredible. So topic number 2, what are common symptoms and what's common, what's normal, what's not normal, when should we worry? We're going to talk about the 7 most common symptoms. Number 1, fatigue. Oh my gosh, this is almost universal. And personally, I remember feeling like I got hit by a Mack truck and I was just lying on my couch. So your body is changing so much. I talk to my patients about your body is actually like it's running a marathon. Your heart is working harder. Your cardiovascular system is dealing with increased cardiac output. Your kidneys are working harder. Just your whole body is changing. And yet on the outside, you might look the same. And, you might have not even told people that you're pregnant yet. It's just incredible how much is changing, and fatigue, being tired is almost universal. It's really, really common. I remember just wanting to put my head down on my desk in the middle of a work day and just take a quick nap because I was so exhausted. And I did try to nap as much as possible, not during the workday, but man, those weekends were really, 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 really important. And even afternoons when I got home, little nap, taking care of myself. Oh my gosh, just so, so tired. Symptom number 2, smell and food aversion. Not everybody gets this, but it's pretty common to love a certain type of food and then all of a sudden you just don't want to see it anymore, or smells can be pretty triggering. It's a pretty common thing, but not everybody will have these symptoms. Symptom number 3, nausea and vomiting. I don't know why they call this morning sickness because it can occur any time of the day or night. It's not every pregnancy, but about 50 to 80% of pregnancies, people will report nausea and vomiting and just an upset stomach. There's lots of theories as to why this happens. It's most common from week 4 to week 9, and very often it can get better through the second and third trimester. There are people that feel this way throughout their pregnancy. I feel so sorry for them, but it often will get better after the first trimester. Some things that can help are eating small, frequent meals and really bland food. So sometimes spicy and fatty foods can make us feel more upset, and an empty stomach can make you feel more upset. Sometimes ginger can be helpful. Sometimes acupressure, there's a point kind of right in your wrist that can be really helpful. These things are not helping you feel better. Talk to your doctor. There are some medications that can help. And if you're really not able to keep food and water down, if you are not feeling well, you should definitely talk to your doctor. There are times where people do get admitted or sometimes feel a lot better with some hydration, with IV fluids or other types of medication. Definitely stay in touch with your doctor. You want to make sure that you are safe and you're getting enough hydration and nutrition for both you and the pregnancy. Symptom number 4, breast tenderness. This is really common. It's due to hormonal changes and fluid shifts, and common to have tender, full, swollen breasts. Symptom number 5, frequent urination. So again, your kidneys are working harder, fluid shifts are happening, and it's pretty common to have to go multiple times in the bathroom more often than you have in the past, and even getting up at night to go to the bathroom. Symptom number 6, heartburn. Oh, I felt this one. Your esophagus and your stomach is not necessarily working the same way with the high levels of progesterone. It can slow down gastric emptying, and it can relax the esophagus to allow some of that stomach acid to come back up into your esophagus. And it can be so uncomfortable. Really common. Talk to your doctor about treatment options, but just super common symptom. And the 7th common symptom is constipation. Again, it comes back to that progesterone hormone. It's the dominant hormone in pregnancy, and it can slow down not only gastric emptying, but emptying of the rest of the intestine. So constipation is really common. Hydration is important. Fiber is important. Moving around a little bit, like actually just walking and moving your body, helps your bowels move. And then talk to your doctor about different treatment options. We'll get back to talking more about the first trimester in just a second, but I wanted to remind you how important it is to follow, rate, and review the show. Wherever you're listening, please do that now. It really helps others find the show. I also just appreciate so much reviews, and this is a great review on episode 54 that we did with Adelaide White. And Vicky says, this is a great episode. I really connected with how you talked about how some cultures still very much blame the woman, and there is so much shame in this process. It's sad. There's so much to be explored with miscarriage and unexplained infertility, and breaking the stigma of shame and feeling inadequate is vital to support women so that they feel that they can speak to others and help each other get advice. Vicky, thank you so much. And I am so glad that you enjoyed that episode. Now let's get back to learning more about the first trimester. The third topic is answering the most common questions that I get from my patients that are finally pregnant. There are 5 common questions that almost every patient asks, and so I want to answer them for you right now. Question number 1 is weight gain. Should I be trying to gain weight? Is it strange that I'm not gaining weight? Like, I feel like in order to have a healthy pregnancy, I got to put on weight. Well, everybody's really different. In the whole pregnancy, people can gain anywhere from 15 to 30 pounds, depending on kind of their pre-pregnancy weight and a lot of different factors. But most people will gain weight in the second or third trimester. In the first trimester, sometimes people can gain around 3 to 5 pounds, but it's not necessary to gain weight in the first trimester in order to have a healthy pregnancy. Question number 2, is cramping normal? Yes, but it can be so worrisome and triggering, especially if you've had a miscarriage in the past. Cramping can sometimes make you worry that, oh, that's it, I'm having another miscarriage. But your body is changing so much. The progesterone is relaxing ligaments, your uterus is growing, and it's really common to have cramping in a perfectly healthy pregnancy. Always ask your doctor if you're worried, but cramping, it can be a normal part of the first trimester. Question number 3, bleeding, spotting, is that normal? So not necessarily normal, I would say, but about 30% of perfectly normal pregnancies that go on to deliver a beautiful baby have some sort of spotting or bleeding in the first trimester. Spotting and bleeding can be a sign of a miscarriage, or cramping, especially on the one side, associated with bleeding, could be a sign of an ectopic pregnancy. So this is important to talk to your doctor if you're having spotting and bleeding. But a lot of pregnancies will have this. If you think about how much your uterus has to change, the fact that this pregnancy and the placenta are growing into the wall of the uterus, that it is such a vascular organ. There's such a great blood supply. The uterus is absolutely amazing. And this placenta is growing into it. And of course, it could hit blood vessels and there could be a little bit of bleeding. It can be a part of the normal implantation. And it's just so nerve-wracking when you see spotting and you see bleeding. Again, especially if you've had a miscarriage before, talk to your doctor, get your questions answered. But the short story is that spotting and bleeding do not necessarily mean that it's an abnormal pregnancy. Question number 4, what foods to avoid? Such a common question, so many different recommendations. And honestly, where you live in the world, there could be different recommendations. So I will tell you the basic understanding and what you should get is that your immune system changes drastically when you're pregnant. Your immune system is suppressed. It's allowing the development of this pregnancy. And with an immunosuppression, with that high progesterone and immunosuppression, you are more susceptible to bacteria on food. So you want to avoid food with a high bacteria content in order to prevent getting food poisoning or getting sick. That is the key. So foods that have a high bacteria content are uncooked foods. So avoid raw meat, raw fish. I know if you're think about people in Japan eating sushi all the time. I know, but it is a higher risk for pregnant people because there could be bacteria on that sushi. That is why it is recommended to avoid. You want to avoid unprocessed dairy. So like raw milk, raw cheeses. These things can have listeria. They can have salmonella. Listeria infection has been associated with really, really ill pregnant people and even miscarriage. So this is where these recommendations come from. Other things that can have high bacteria content are deli meats. If you're eating hot dogs, you've really got to cook it thoroughly. And then the other thing people ask a lot about is fish. So if you're eating fish, you're cooking it, you don't want to have it raw, but how much fish? Well, some fish have a high level of mercury, and you want to limit your exposure to mercury while the baby's brain and spinal cord are developing, which is so important, especially in the first trimester. So there are great lists online for fish and which ones to avoid and which ones are safer, but some kind of guidelines are larger fish that are eating smaller fish have a higher chance of having mercury because they're kind of eating all these little fish that might have been exposed to it. So big fish like king mackerel, swordfish, big tuna, those are ones to avoid. And other fish like salmon, sardines, anchovies are typically safer. The FDA does say that fish is important. It's a wonderful source of nutrients and omega-3 fatty acids, which are great for baby's brain development. And that if you're going to eat fish, try to limit it to 2 or 3 servings per week. And a serving is about 8 to 12 ounces. Another food, something you ingest to think about is caffeine. In general, high levels of caffeine intake have been associated in some studies, but not all, with a slightly higher chance of miscarriage. Most doctors will recommend limiting your caffeine intake to less than 200 or 250 milligrams a day. In general, 1 cup of coffee in the morning is probably okay because that's typically less than 250 milligrams of caffeine. But talk to your doctor if you're worried at all and think about your caffeine consumption. And question number 5, what about exercise? Exercise is so important for your mental health, your physical health. You might not really feel like exercising a lot because you are so tired and your body is working so hard, but moving your body is important. I talk to my patients about avoiding really strenuous exercise or starting a brand new routine. You don't want to all of a sudden train for a long distance run like a marathon when you've never done that before and all of a sudden you're pregnant. You want to avoid things that can dehydrate you. So really strenuous exercise or like hot yoga. I don't love that because it's so important to stay hydrated. And if you're really just sweating out profusely, it's just going to be harder to stay hydrated. I think about types of exercise that are high injury, right? So downhill skiing, wakeboarding, water skiing, just things that you could fall, you could have a really traumatic twisting. And I just think about this pregnancy is so precious. So just think about staying healthy, moving your body, but just not too strenuous. But also don't be completely sedentary. Just move a little bit. Long walks. Prenatal yoga is wonderful. Hiking can be great. Strength training, wonderful. Low impact rides on your Peloton, if that's what you enjoy. Jogging is fine, but maybe just modify how far you go and how hard you're running. Talk to your doctor if you are curious about your personal situation, but exercise is important. Just maybe modify. So we've already gone over a lot for what to expect and all about the first trimester. We explained what the first trimester was and exactly what's going on with your body and the developing pregnancy. We talked about what symptoms to expect and a little bit of tips on how to know if something is normal or not normal. And we reviewed 5 of the most common questions that my patients ask me in the first trimester. Now, I want to leave you with some top tips on how to take care of yourself in the first trimester. So rest, listen to your body, take naps, hydrate, make sure you're constantly drinking a little bit of water, just stay hydrated. It's just so important. Remember to take your prenatal vitamin. Actually, taking a prenatal vitamin for a month before you get pregnant decreases the risks of nausea and vomiting in pregnancy. And taking a prenatal vitamin up to 3 months before you get pregnant actually decreases a lot of pregnancy complications. So just don't forget to take a prenatal vitamin. Now, if you're starting to have a lot of nausea and vomiting and it is just too tough to take that whole prenatal vitamin, think about switching to just folic acid. Sometimes the iron in a prenatal vitamin is really hard for our bodies to digest in the first trimester, and we don't really need that iron typically until the 2nd or 3rd trimester. But the folic acid, that's the one that you really need in that first trimester to decrease the risk of neural tube defects. And finally, you've got to stop some things. If you haven't already, make sure you stop smoking and exposure to tobacco. And this means in your household too. Secondhand smoke can be very harmful to the developing pregnancy. Stop alcohol, of course. Nobody knows how much alcohol is safe, and fetal alcohol syndrome results from the fetus being exposed to alcohol in pregnancy, and especially in early pregnancy when those organs are developing. And finally, marijuana. Stop marijuana. I know some people really feel that it's probably safe, but studies show it can be associated with preterm labor, miscarriage, and other pregnancy complications. I hope you enjoyed this episode. I really hope it helps you through your first trimester. I really want to remind you, I am not your doctor, unless you are my patient and you are listening. A lot of you do. But this information does not substitute for your own medical care, and you really need to talk to your doctor about your personal situation. But I do hope that it helps you think of questions to ask, or make sure that you kind of know what to expect and learn a lot about this first trimester. I hope you learned a lot. Find this episode and all others on my website, drlorashahine.com. Find more educational information on my YouTube channel, Instagram, TikTok. I just love teaching. Share your own fertility story or things you'd like to hear about on the show. Send us an email to hello@drlorashahine.com. Thank you to our friends at Seattle Sperm Bank and Braze Run Production for sponsoring the show. Thank you to my producer, Shannon Perry, and her team at Audiotocracy. This is your host, Dr. Lora Shahine. See you next week. And until then, wishing you love, luck, and pineapples.